Hey, how you doing? Dr. Richard Busch here again. Now, today we're going to talk about the R in DRS protocol. DRS stands for decompression, reduction, and stabilization. Now, the R is reducing pressure. So we're reducing pressure from the nerves that exit the spine. Now, where those nerves exit the spine, they go to a couple of different things. They go to skin, they go to muscle, and they go to organs, okay? And so if there's pressure on those nerves, from the disc or from other tissue or just from inflammation, it can actually affect the sensation that you have in the skin. So you may notice some numbness or tingling in part or all of your leg. You may notice muscle weakness, which is very common, and we may even see some muscle wasting, so those muscles might get smaller as a result of lack of communication with the brain. And along with that, you may also notice different things. We see patients that may have had pressure on those nerves that can affect their bowel or their bladder. And along with that, it can also affect whether they're able to get it up or not.